morning. I'm Dr. Wickham Simonds. This is Michelle Kennedy.
Good morning.
She's a nurse practitioner here at our office, and this is the Ask Me Anything Facebook Live.
Yes.
What's today's date?
15th?
November 5th. Yeah. Holy cow.
It's the middle of the month.
It's happened already. So November 15th, and well, the year's going by, and Thanksgiving is next week.
It is.
Anyway, we're open today in
Yes.
both locations, as we always are on Monday, with our on-site pharmacy and providers that can see you. We have a $25 gift card, as we've been doing. It's
Yes,
available to win today. You got to like the video,
Yeah.
and then you got to comment, and you got to put hashtag Simonds AMA, right?
Yes. And of course, any other comments you have or questions, please share them because we will answer them live, as well as some great questions that we've gotten.
Yeah.
We're answering weight loss questions and questions about health, our practice. Really, if you want to know about it, ask us a question about it, and we'll be happy to answer it. That is what these are for. And keep submitting those questions between, because we'll keep doing them on our Mondays. So Sandy asked us at the very end of our show 2 weeks ago. We did not have a chance to get it, but we really wanted to address it because it's a good question.
Yep.
Sandy was asking that she was having a really hard time losing weight despite being on a diet. And we had recently put her on Metformin, and it seems to has really helped. She was wondering, how does Metformin work? She had found out that her glucose, fasting glucose was running a little high before starting the Metformin. So this is a perfect scenario, Sandy, where someone has an elevated fasting blood sugar, because Metformin helps lower insulin when we produce too much of it, and then that will bring our fasting blood sugar down. That will help bring our weight down. It can even reduce appetite. And
Metformin lowers insulin.
Yeah.
And the fasting glucose is when you haven't been eating overnight. You check your fasting glucose in the morning. I'll make a note there. Sandy, when you do a low carb diet, it is the reverse of the normal situation. People who are eating a carb-based diet, when they're getting pre-diabetes and diabetes, they will have an elevated fasting glucose when they get up in the morning. People who genuinely do a ketogenic low carb diet actually will have their highest blood sugar in the morning and their lowest one in the evening. It's the reverse of normal. So if you've been following religiously a low carb ketogenic diet, and you're in ketosis and you have a high blood sugar in the morning, that is normal. That tells me that you've been eating the correct food, and overnight your blood sugar gets really low. And what happens in the morning is that because it's so low, your liver dumps out into your bloodstream some stored blood sugar, and stored sugar into your bloodstream, and then that raises your blood sugar.
Called the dawn phenomenon.
Yes. There was also a doctor, I think he was a Japanese doctor, the Simonds effect, I believe is what it's called.
Yes.
Yes, he was the one who first coined it. And so anyway, that's normal. And so, but if you did a low carb diet, you're not eating carbohydrates all day long, and your body's out burning up glucose and stuff, what happens in the evening? You check it and it's normal.
Down, yeah.
That's right. Yeah. So for the people who aren't on a low carb diet, fasting blood sugar is an accurate picture of what's going on. For people who are really on a low carb diet, evening blood sugar is a better picture. Thanks for joining us. We're giving away a $25 gift card again today.
To Target.
Yeah, that's right.
Thank you for Susie and Holly for entering. You got to like the video and hashtag Simonds AMA in the comment section.
That is correct. All right. So let's go on to Jody's question. Jody from Raleigh. What are some what are some of your go-to keto-friendly Thanksgiving sides?
It's a good one. Next week already, for sure. I love all vegetable sides. I recommend a lot of greens. You can do asparagus, you can do green beans, and you can still even make a really delicious green bean casserole without using a ton of carbohydrate, right?
Correct.
You can do some heavy cream. You can put
go to our Casual Keto Doctor
Yes.
Instagram site. We
Yes.
have a ton of good recipes for that sort of thing. You can take Brussels sprouts, half them, cook them in bacon grease and butter, and sear them on the edge. That makes a great side, for really. My wife and I were talking about that. And, the price of turkey going through the roof. So I may just go with something like a brisket.
Oh,
and
yeah.
then have that as a side, you see.
Yeah, I would do
Yeah.
mashed cauliflower with
Right.
that too.
There you
Because
go.
sometimes
You
it's
can-
nice to have something that kind of
Yeah.
mimics potatoes.
That's
So you
right.
can either do like a
You
scallop.
jazz up the cauliflower with different, again,
Yeah.
use some of the bacon that you use, make the bacon
Yeah.
grease, chop that up, and put that in
I'll
the
put some
mashed
chives
potatoes,
in there.
and the mashed
Mm.
cauliflower, if you will,
Mm.
mimicking the mashed potatoes. Right.
Yeah. The things that are going to be more challenging are the things like the cranberry sauce. I mean, you technically could make your own. There are low carb versions because cranberries in and of themselves, when there's not a bunch of sugar added to them, are actually pretty low in
Yeah,
carbohydrate.
They are.
So you really can kind of cook
That's right.
down some fresh cranberries. And if you want a little sweetness, you could add stevia, monk
Mhm.
fruit, swerve, even Splenda,
Yep.
and make something like that so that it feels like a full Thanksgiving feast. And you can make stuffing without bread as well. I've done it before, and all the flavors there. We just want to make sure that regardless of the sides or the entree, that we're indulging, but we're not overindulging, right? Holidays are for celebration and joy and gathering, and food is a part of that. So we don't want to not enjoy it. We just don't want to get to the point of regret afterwards. So have a little bit of the things that you're really looking for. Just don't have too much of it.
Yeah. I mean, I think that to go back to the pilgrims, people often forget the historical context of Thanksgiving. These people came in the fall of 1619 and landed somewhere, to my recollection, up by Rhode Island.
Mm-hmm.
But do you think if you land in October in Rhode Island, you can grow any food? No. Okay. And they weren't the best hunters. Okay. They came from England, and half of them starved the first winter. Half of them. Okay. So they consulted, they used the modern term, they consulted the locals at that time, which were American Indians then, who taught them techniques for farming in that area and how to hunt, how to fish the area. And they had a plentiful harvest. Okay. And that led them to celebrate. And by the way, so I think Michelle knows this, but I remind patients, because you have this kind of very short memory as Americans, right?
Mm.
They didn't have refined sugar and flour. Okay. Hint, hint. They didn't have pies and cakes and all this other stuff. And, you know, when you're a 6 foot tall man and your weight is 120 pounds, it's fine if you want to engorge yourself on turkeys and deers and stuff like that. Okay. All right. And fresh vegetables. But in today's modern era, to the producer's point, you know, about indulgence, right?
Yeah.
You really don't need to do all this.
Right.
And is this how you thank God? Well, Lord, I don't thank you for a good year. I think I'll just eat until I get some diabetes.
Mm.
Now that doesn't make any sense now, does it? Right. So, so that's why we're here.
Yeah.
We're here to help you. You
Yeah.
know, we give you medicine and stuff to help with your appetite.
Mhm.
We try to coach you through these situations ahead of time so you don't make mistakes. If you get all off track and screw it up, we don't get all over you. We say, hey, let's get back on track, okay?
just come
Because
on back.
there's no way you can change the water that's gone under the bridge. You just can change what's going forward, right? And we're here to help you. But I'm trying to remind people, I do this every year ahead of time.
Mhm.
Hey, you know, it's okay just to go have a little bit
Mhm.
and be done with it, just like you would at a normal meal.
Yeah.
And then spend the time fellowshipping with folks and bless them. And but don't make it all about just engorging yourself, right?
Yeah, absolutely. And we're going to have, as we do every year, many patients who maybe we don't see for these next few months, and then they come back, and that's okay, right? There's no need to try to lose the weight that maybe has been gained over the holidays before you come back to lose the weight, because we hear that all the time. So please just give us a call, right? That's all it takes. Give us a call. We'll get you on the schedule. We get you in.
That's
and
right.
we'll get you help and support.
That's
okay?
exactly right.
So enjoy your Thanksgiving,
Yes.
Jody. I hope you get some really delicious sides from that Casual Keto Doctor website. Okay, so Susan is asking from Carrie, should you increase your water intake when on a ketogenic diet? The answer is a resounding yes.
On every diet.
Yes.
Yes.
Yes. We should all be drinking more water.
You should restrict soda and tea intake and
Yes.
increase your water intake.
Yeah, I think it's safe to say most
Yeah.
Americans are walking around dehydrated. So we really do want to increase water intake, like Dr. Simon said, regardless of what we're doing. But on a ketogenic diet, yes, it is very, very important because as we've talked before, there's going to be a natural release sodium and electrolytes and water will follow. So there's going to be more of a depletion, which is a good thing, right? Of some of the water weight and some of the hydration. So you just got to make sure you're putting that back in as well as those electrolytes.
Yeah. That's exactly right.
Yeah. So thank you for that question. It's a good one.
Oh, Karen from Durham. I like this one.
Mm-hmm.
Do you offer non-surgical fat removal? And who do you recommend for these services? I recommend us. I recommend us, Karen.
Yes.
We do offer it. So we haven't made a big deal about it. We're about to make a big deal about it. So I rented some office space next door to our Durham office. Is a space that was sitting unoccupied. We rented it, upfitted it, and we have some machines there made by the biggest player in this field of non-surgical fat reduction and skin tightening. The name of that company is InMode. And so if you were to see the different celebrities that use InMode that aren't paid spokespeople, but that have put comments on social media, it is a very large number of them that really like these products, and they're very popular. So we have 3 machines. We have Evoke, which does face and jawline skin tightening and fat reduction to give you a more defined jawline. And we have Evolve, which does that on the body. And then we have Morpheus 8. And Morpheus 8 is very popular. It is slightly invasive in that it uses needle tips and radio frequency, but you can treat all sorts of places essentially from head to toe that have fat accumulation or loose skin. And it is a fantastic modality to use to do this. Now, what I would say is 2 things. Anna, my wife, who's a registered nurse, done a lot of training in this area, and she will give you a free consult. And all you have to do is call the office. It's really easy. We'll put you right in touch with her, and she'll schedule a time for you that is convenient. We're offering these services now, and she'll bring you over, show you these things, give you an idea of, she's going to give you an idea of whether or not this is an appropriate treatment for you, number 1. Number 2, what would be involved in that treatment and how much time it would take and what kind of result you could expect and all that sort. And that will cost you nothing. She then can tell you, say, hey, look, here's how this stuff is priced. And I would just say, given what I've seen out there in the market, our prices are very affordable. And we priced it to our patients at a rate that's really lower than what most of the competition is doing. So my phone keeps going off. I apologize for any of you that can hear that.
And just so you all know, we are the only weight loss practice in the area that offers this service.
Yeah.
And I think we get a lot of questions like, is this cool sculpting? Does it hurt? No, it is not cool sculpting, but people who would be looking at cool sculpting would probably be interested to know that this is an option as well, which
this is I just got back from an InMode event over the weekend out of town, and I would just say, although cool sculpting still does a lot of advertising, that is like saying a Chevrolet Lumina. Have any of you recently bought a Chevrolet Lumina? Okay, all right.
Old technology, I guess.
Yes. That's right. Okay. That was the beginning. And that would be like saying iPhone 6. Okay. How many of you still have your iPhone 6? A few of you do, but most of you have graduated and have a 12 or a 13, for example. InMode is the cutting edge, and it is a lot less, cool sculpting is, in fact, many people will describe it as painful. InMode is not. The results are fantastic. And so I'm really excited about this technology. I will say it's not a cure-all. So I get this question a lot. I want to make sure to clarify this. If you're planning to use this as a weight loss technique, I would say don't. Okay. Your diet, your exercise, your medication, this is your weight loss technique. If you were going to the plastic surgeon, for example, to get liposuction, and you said, I plan on eating an entire red velvet cake in the morning. At night, I'm going to eat a dozen donuts. And in each case, I'm going to wash it down with 2 liters of soda. Okay. That plastic surgeon would never give you liposuction because you're not going to get a good result because you're in a fat storage mode all the time. So if you're going to do a fat reducing technique, whether it's surgical or non-surgical, I suggest that you do it in conjunction with the diet that you're doing and losing weight. Or if you've lost weight and maintaining your weight, right? And this is when it's the most effective. And so we think it pairs very nicely with what we do because that's the kind of, patients that treat.
Right.
So,
Right.
uh,
And the Inmune Company certified us to be the only practice in the area to do this. So right now we are not advertising as much, but we're getting ready to.
That's right.
And people who are not our patients can do it as well. But right now it just makes sense because we have so many patients who have done such a wonderful job, but due to gravity and time and just the way skin works, even when you lose the weight and you work so hard, not everything goes back to the way it was before. And that's kind of where this comes in. So you feel like you're reflecting on the outside how wonderful you feel on the inside. So thank you for that question. And just a reminder, we're giving away a Target gift card, $25. We just need you to like this video and comment #SimonsAMA. And we will draw the winner today at the end of this. So not too long to wait. Shall we move on to Tim?
Yes, Tim from Raleigh.
Tim's been losing weight for months, about 30 pounds. Congratulations. That's fantastic. Asking, should I readjust meds based on weight loss or is it too soon? So there's a way to address this if it's weight loss medications, and then there's if it's medications outside of what we are prescribing, like your primary care, such as blood pressure medications, cholesterol medications. The answer, I'll start with the latter. If you are on blood pressure medicine or blood sugar medicine, you will likely need a reduction, which is why we have medical specialists here, nurse practitioners, physician assistants, medical doctors who can help guide you on how to safely reduce medication so that it does not become unsafe for you when they become too strong because you've lost weight. So likely there would need to be, Tim, if you're on like a blood pressure medication, there will likely need to be a reduction, but we take your blood pressure every time we're here. So if it's coming down, we can then advise you on how to do that. As far as weight loss medications go, when we prescribe medications to help people manage their weight, we prescribe them in the long term. So while there are scenarios where when you reach your maintenance goal that you want to maintain long term at that weight, we may address, possibly seeing if we can cut back. If you're on multiple medications, can we maintain with less dose, less number of medications, less frequency in taking it? But I will tell you from experience and just from the knowledge of the fact that weight is a chronic, progressive medical condition, generally chronic long-term treatment is also required. So we are not looking forward to taking people off their medications, right? That's like putting you on blood pressure medication, your blood pressure drops, and as soon as it hits normal, taking the medicine away and saying, good luck, I hope your blood pressure stays down. If the medicine was how you got to that healthier state, we are not going to snatch that medication away. That doesn't mean we won't have a discussion with each individual on what their needs are in maintenance and if that's different than in weight loss. But I think that's a really important point, and I think we still need to talk about that a lot with folks and with the general community. This is not a short-term thing. It's not an infection. You don't treat it, it goes away. You treat it, and then you keep treating it so it does not relapse or get worse again. Would you agree?
Finish line's the grave. I've always said it. Finish line's the grave. Look, the producer keeps reminding me, but I think most of you know this. Obesity is the cause of most of these other conditions. And when you treat the other condition, the obesity, the other conditions go away.
They do.
That's the bottom line.
They do.
That's the bottom line. Obesity causes multiple other medical. In fact, just pick. I'd be surprised if you can find one that obesity doesn't cause. Maybe a broken leg.
There's well over 200 medical conditions that are known to be worsened or actually caused by
obesity. Yes. So I'm just like, treat the root cause, and the root cause is obesity. And so then why would we want to take away some medicine that helps you lose weight if you can get rid of a bunch of problems? Right. A bunch of other medical problems. And the hospitalizations and the excessive testing and the psychology of sickness that comes with all of that, right? You want to free yourself from that stuff.
Yeah, absolutely. Absolutely. And the medications that we use for weight are safe to be used long-term. All of the newer agents were approved for long-term use. They were not approved to be used for a few months.
That's right.
So people could figure it out. And then
that's right. Yeah.
taken away medications, and they are safe and they are effective. And for many of us, they are a requirement in order to keep the weight off that we work so hard to lose.
Yep, that's right. So Melissa from Wake Forest.
Do you treat pre-menopausal patients, and what kind of success have you seen?
Mhm.
Absolutely, Melissa. Yeah. So we have many female patients in our practice who are in that perimenopausal or fully menopausal state.
That's right.
And that is something that I think a lot of women struggle with, because as hormones change, and men do as well, there's menopause and there's also andropause. As we get older in general as humans, things are different. What worked for managing our weight or just managing our health and our energy levels and our sleep, what worked in our 20s or our 30s, it does not work as well as our hormones start to drop, which for women at age 35 is when the decline starts to happen. And some women will go through an earlier perimenopausal, maybe in their early 40s or mid 40s. The average age is usually closer to 50 when that menopausal, full-blown menopause is occurring, where you stop menstruating for a year. But many women in our practice are in this category. And we really are skilled here in helping individuals figure out what they need to do in order to make it work. Because so many times they come in and say, everything I'm trying is not working. And it is so frustrating, so frustrating. So we can help you with tools, medications, guidance, and a low carbohydrate diet.
Yes.
In this scenario, it really is. I mean, in all scenarios, it's really effective. But man, when our hormones start to change as women, going low on sugar, low on processed starch, potatoes, rice, it makes all the difference with us being able to lose weight, especially that stubborn weight that starts to gather right in the midsection. So we have all kinds of success. I urge you, if you're not already a patient, give us a call. If you are and you haven't been for a while, come back and see us.
Can you read that question?
Looks like we have a question in the comments from Joanna. Should you do a colon cleanse when trying to lose weight? This is a good question. I get this in the office a lot. I do not typically recommend things like colon cleanses. Our body is poised with a liver and kidneys and bowels to detoxify and cleanse. It is how we are made. While there are things that we should be doing to help upregulate these detoxification and cleansing pathways, like drinking plenty of water and eating more whole unprocessed foods and keeping all this ultra processed crap out, a colon cleanse is not something that I'm typically recommending.
Correct.
Yeah.
Nutrition to pollution is dilution. Drink plenty of water, okay?
Yes. Okay. But if you are having constipation, then magnesium is something that we would recommend for that. Magnesium citrate or milk of magnesia, just to naturally help make sure things are moving. We have another question. Holly's asking, what do you recommend for the best fasting results? I guess that could go a lot of different ways. I think finding a fasting regimen that really works for you physically, for your schedule, right? We may need to adjust medications to make it work, making sure you're drinking lots of water.
Yes.
Right?
If you're hungry all the time during the fast and miserable, it'll be terrible.
Yeah.
If you're taking some medication that helps with your appetite that we will give you here, it makes it a whole lot easier.
Yes.
How about that?
Yes.
Right?
Yes.
Okay.
And water and
Why
electrolytes
subject
are going
yourself
to
to punishment and pain when you don't have to?
Right.
All right. Fasting's a whole lot easier when you take an appetite suppressant. Hint, hint. Our offices are open and we can help you. Okay.
Yes, absolutely, Holly.
And the benefits of fasting are numerous. So.
Yeah. And the 16-8 that you're mentioning, yes, that is a very common one. That is not the only one, though. So there can be other restricted feeding windows that we can play with. Some people, it's 3 days a week. They do a 24-hour fast, right? So there's a lot of different ways that fasting can look.
16-8's just skipping breakfast.
Yeah.
Okay. Why don't you try skipping breakfast and lunch? Eat once a day. That's really a 24. Okay.
Right.
So the further you take it out, the better it is. And so I don't think in many cases 16-8 is enough for most people, although it's good and I encourage it. Mm-hmm. I really encourage them pressing the envelope a little bit more. Okay. I mean, our ancestors went sometimes a couple of days without eating.
Right.
This is where the idea, and this is programmed in our DNA. We're adapted. We overfeed ourselves. So I think that, with the help of medication, you can eat, and most people can do it at 24 when they set their mind to it, right?
Yeah. And nutritional guidance is going to be important too, because when we're really trying to optimize health and optimize weight, we cannot go down the path where, because we're fasting, we can eat whatever we want during our feeding window. So we really do still have to be selective, especially when you're eating less. You need to make sure that when you do eat, it is nutrient dense and it is really fueling your body in a way that you need. So you're going to be getting some protein, maybe some healthy fats, some healthy fiber. So it is still important, not just that you're fasting, but what you are eating when you're feeding. All right, it's twofold. There's the fast and the feed that we have to worry about there.
All right, Tanya from Durham.
Can
you lose weight? Even if you don't stay in ketosis for long periods.
Okay.
Yes, you can.
Yes.
Yes, I promise. There are many diets that work that help you lose weight. I always say starvation works every time. It'll make you skinny. And most diets are calorie restricted in their character, whether they tell you that or not, and whether you're in ketosis or not. So I promise, some form of controlled starvation will always work. Yeah. And so anyway, the kind of diets that we encourage people to do here are low carbohydrate in nature, so you don't have to feel like you're starving yourself. Right. That's fine if you want to try to starve yourself, but when I say that, I mean like in a controlled manner, like intermittent fasting, right? Okay, but we do care that you learn how to eat normal whole food for the rest of your life. Yeah. So that this is something you feel like is a short-term fix for a long-term problem. Yeah.
Absolutely. So we have another comment. Thanks for these live comments. This question is great. Sadie's asking, carbing up, yes or no to lose weight? Nope. That's an easy one. That is. I'm glad you asked it, because that actually is a really good question. There is a lot out there about carb cycling, which it can work. My initial response is no. And then maybe there are some caveats, right? When you're on a plateau and you're stuck and you need to do something different and you're really low carb, will having one meal where you introduce carbohydrate help? Possibly, but we have to make sure that it is just the one meal and it does not trigger an avalanche of unfortunate events that then later are regretted.
That's right. There was one really popular diet, and it's still, I'm not going to say the name of it or anything like that, but in its original form, you would carb up for a couple days before then starting a certain medication, and then starting this calorie restricted low carb diet to the tune of about 500 calories a day. And so that some people still have that idea of the carbing up. Right. Yeah. In other words, it makes your liver swell with stored glycogen in your muscles and your water weight, and you gain this 5 or 10 pounds of water weight, and then you weigh in and you start the first day, and immediately in the first 2 days, because you get into ketosis and you pee all that off, you lose 10 pounds, and everyone's psyched up. Yes, I lost 10 pounds, and it's mostly water weight. And then they're all encouraged to stick with the 500 calorie a day diet, which is very hard to do. Yes. Yes. So, it is. All right. Absolutely. So thank you for these questions. I think we're going to announce our winner for a $25 Target gift card. Susie. Thank you, Susie. We'll contact you with the details. Thank you for everyone for attending and joining us every 2 weeks on a Monday. We'll be back in 2 weeks, because next week is Thanksgiving. So we'll see you in 2 weeks. Go to Casual Keto Doctor. Check out all the recipes. All right. We'll have this video. The Casual Keto Doctor Instagram site has a ton of recipes on there. And it's good to look at before Thanksgiving. It is. And this is going to be recorded. You can watch it later. We'll have notes as well. And visit our website, simonsmetabolics.com, for more details. And if you want to come in and see us before the holiday, give us a call. We're here. We're open. Thanks, everybody. Have a good Thanksgiving. Have a good Thanksgiving.